Meanwhile, health is among the most affected sector as anti-protest paralyzed key services across the country. Now, this has left patients stranded with a number forced to cancel their scheduled appointments. And some hospitals are now forced to offer limited healthcare as medics are not able to report for duty, citing transport and safety challenges. Businesses and schools in some parts of the country shut down due to anti-government protest. The script is similar, if not worse, for some health facilities in the country. Jaramogi Oginga Odinga Teaching and Referral Hospital is among some of the private and public hospitals which witnessed cancelled appointments, fewer patients as well as healthcare workers.
They cannot make it to the hospital because public transport is not working. Many vehicles are not on the road today. So people are having a problem to reach to the hospitals to be supported.
It's the responsibility of the opposition to ensure that the areas they control, essential services continue uninterrupted to ensure that citizens continue to get those services.
The hospital management has been forced to halt major services such as surgeries, laboratory and MRI services.
Routine things which happen in hospitals like physiotherapy are now on hold. What has happened is that many health workers were not able to make it to stay in the hospital beyond their normal working hours.
To ensure smooth service delivery at the hospital, health workers who reported on duty before demonstrations began were forced to work for long hours.
We'll give them food and places to rest. Today being Wednesday and then Thursday, you're talking about 72 hours.
It is not any humane, or it is not within our principles and principles of work ethics for us as health workers to leave hospitals to go and say, my shift is over, I can't continue working, I'm going home, and you're leaving that patient unattended to.
Hospitals in Kisumu, Mombasa and Nairobi were most affected. The Kenya Medical Association is urging the government to provide a hotline number for stranded patients to access health facilities for treatment.
We have expectant mothers. We have children that can get sick or children that are sick. We have people that need emergency services, not necessarily the one affected by the protests, but people in this area that actually require healthcare services, but they are not able to get out.
Nurses through their union are now asking the warring parties to find an amicable solution to the dispute. Brenda Zeda Radido, KTN News. So that is what happened at, in connection to Mandamano, hospitals in Mandamano, as we've painted for you a picture there. So I'd like us to go to Kakamega County.